Bienvenidos al podcast de la Sociedad Latinoamericana Interdisciplinaria de Cannabinología SLIC. Para el 2026, este podcast reúne a varios investigadores de renombre internacional y pioneros en el estudio del cannabis, los cannabinoides y el sistema endocannabinoide, cuyas contribuciones han sido fundamentales para dar forma al conocimiento científico actual en este campo. A lo largo de décadas de investigación, su trabajo ha definido conceptos claves, ha abierto nuevas vías terapéuticas y ha contribuido de manera decisiva a la historia de la ciencia cannabinoide. Mi nombre es Paola Cubillos, soy miembro fundador de SLIC y nos llena de orgullo poder ofrecer este espacio de diálogo y aprendizaje para la comunidad latinoamericana. Hoy tenemos el gran placer de presentar una figura del mundo de la investigación en los cannabinoides a la doctora Ziva Cooper. Ziva Cooper es directora del Centro de Cannabis y Cannabinoides de UCLA en el Jane and Terry Semel Institute for Neuroscience and Human Behavior y la profesora de los departamentos de Psiquiatría y Anestesiología de la Universidad de California en Los Ángeles. Es una de las investigadoras más reconocidas internacionalmente en el campo de los cannabinoides, con un enfoque centrado en la evaluación rigurosa de los efectos terapéuticos y adversos del cannabis y sus componentes en los seres humanos. Su investigación se ha enfocado en comprender cómo variables como las dosis, la vía de administración, el contenido de THC y CBD y las expectativas del usuario y características individuales influyen en los efectos subjetivos, cognitivos, analgésicos y potencialmente problemáticos del cannabis. La doctora Cooper ha desarrollado y liderado ensayos clínicos controlados con placebo que examinan el impacto del cannabis y los cannabinoides específicos en dolor, trastorno por usos de sustancias y otras condiciones clínicas, aportando evidencia clave para la toma de decisiones regulatorias y clínicas. En cuanto a su producción científica, cuenta con una amplia trayectoria de publicaciones en revistas de alto impacto en farmacología, psiquiatría y neurociencia. Es autora de más de un centenar de artículos científicos revisados por pares, capítulos del libro y revisiones especializadas que abordan desde los mecanismos neurobiológicos de los cannabinoides hasta sus implicaciones clínicas y regulatorias. Su trabajo ha sido citado extensamente y ha contribuido de manera significativa a la comprensión de los efectos agudos y crónicos del cannabis en los humanos. La doctora Cooper ha sido presidenta del International Cannabinoid Research Society, fue directora de la Junta Directiva del College of Problems of Drug Dependence y es directora asociada del American Journal of Drug and Alcohol Abuse y Neuropsychopharmacology. Asimismo, forma parte de los consejos editoriales de varias revistas científicas especializadas en cannabis y cannabinoides. Para nuestra sociedad, es un verdadero honor y un motivo de profunda gratitud contar con la doctora Cooper como una miembro de nuestro comité honorario. Su apoyo y cercanía representan no solo un reconocimiento a nuestro trabajo, sino también una inspiración para seguir fortaleciendo la investigación rigurosa y colaborativa en nuestra región. Para quienes nos escuchan, la conversación a continuación se llevará a cabo en inglés, pero incluiremos resúmenes de cada intervención de nuestra invitada en español para facilitar la comprensión de sus apreciaciones. De la misma manera, podrán acceder a la transcripción del episodio en inglés y en español. Nuevamente, es un gran orgullo y un privilegio contar el día de hoy para nuestra conversación SLIC con la doctora Ziva Cooper. Bienvenida, doctora Cooper. Thank you so much again, Dr. Cooper, for agreeing to join us. It's a great pleasure to have you and to get to chat with you a little bit about your life and the exciting space of cannabinoid science.
Thank you so much. It's wonderful to be here.
Thank you so much. The one question that, we're starting off with all of our guests, because this is such a unique field and it's a field that people, when they go through their research training, they don't necessarily decide to sort of enter automatically. There's always a story. There's always a little bit of an interesting background or an experience or a little bit of a motivation that led them to enter into this exciting space. So what's your story?
A really good point. We all have these windy paths to how we've ended up to where we are at. And, if you had told me 15 years ago that I'd be where I am now, I would have said, oh, you're crazy. Because I started off as like an anthropology major. I studied I was really interested in other cultures. And then I became interested in how other cultures use plant medicine as like a side thing. And then I became interested in pharmacology, psychopharmacology. And my PhD ended up being in preclinical psychopharmacology, so using animal models to understand substance use disorders, so addiction, specifically with respect to opioids. So we know that opioids are a class of drugs. They come from, the poppy plant, right? So they are kind of naturally derived, a lot of them. And we know that, opioids have therapeutic effects. They are good for pain, but there are also a lot of adverse effects, and addiction, of course, is one of them. And so I spent my graduate career studying opioids and really being interested in those. And then for my postdoctoral fellowship, I moved on to continue studying opioids with a wonderful internationally known professor, Sandy Comer at Columbia University. And while I was there, I was introduced to Dr. Meg Haney, who's a pillar in the cannabinoid field. And that was around the time when some states in the United States were starting to legalize cannabis for medical purposes. It was really just a few states at that point. It was 2007, so maybe there were a handful of states. And Meg was studying cannabis in the lab in humans, which was very unusual. It still is pretty unusual today. And she had already been doing some work understanding the adverse effects of cannabis, as well as the potential therapeutic effects, understanding which constituents contribute to the adverse effects. And so I became really interested, in part because we were seeing that public policy was changing dramatically from, cannabis being totally illegal to all of a sudden, like in some states, it was being permitted. And it was being permitted for certain medical indications. And, I think that for a lot of people, when they see that there's evolution in public policy related to healthcare or some health types of outcomes, usually people think that those public policies are really rooted in science. But, when you dig deep, especially back then, and try to find evidence for, the therapeutic effects of cannabis for the specific indications that states were legalizing cannabis for, there was really very little evidence. And there was this kind of like a disjoint, or like a separation between, public policy, then people's perceptions of what cannabis can or cannot do, and scientific evidence. And so it seemed like, A, there were a lot of questions that needed to be answered, and B, that those questions were really timely, had a great deal of public health relevance, and C, working with Meg, I was in a place where I could be trained to kind of go down that path and investigate those areas that were most interesting to me. And so that's how I kind of started out. And then over time, states were legalizing, and we know that different countries were legalizing. I think Uruguay was legalizing as well. Canada started to legalize. And California, which was the first state to legalize for medical purposes, they were starting to talk about legalizing for non-medical purposes, adult use. And at the time, there wasn't that much research being done in Los Angeles, even though Los Angeles, where I am right now in California, was a really big hub for product development, patient use. Clinicians had a lot of questions. And so over time, I developed there's a calling here in Los Angeles, and a great deal of interest at UCLA, University of California of Los Angeles. And so I moved here to be able to, work in the area with colleagues from around the university who are interested in understanding cannabis and legalization and the impact on society from all different types of lenses. So it's been a really exciting journey thus far.
Well, and we are so grateful that you decided to sort of, take on Dr. Haney's enthusiasm or, the opportunity to explore cannabis, because you've taken a really interesting sort of path in your career as well. Not only are you well-versed in sort of preclinical sort of kind of research, but you've also done a lot of human experiments as well in the pain area, but your research is also translated quite well into public policy. So you're sort of dipping your toes into several buckets of research, which is fantastic. It's not something that we normally see with your conventional researchers. They try to sort of follow the one sort of methodology and the one space that they operate in. So how do you manage to sort of juggle all those different balls and just to keep successfully contributing to the evidence based in all those areas?
You're so kind. Thank you. Thank you for your encouragement and for your words. I think there are so many interesting questions to ask. And behind those questions are the interesting people and the very relevant and important public health needs. And it is hard to stay focused, I guess, in one lane, which is maybe a blessing and a curse. But I think we are so lucky to be exposed to a community of practitioners, clinicians, scientists, scholars who are so interested in cannabis and cannabinoids from so many different lenses. And the community itself is engaged and engaging and warm, and people are very open to talk about the different perspectives. It is overwhelming to have lots of toes dipped in different areas, but it's so exciting. And to be able to work with collaborators who are doing preclinical studies in animal models that can tell us so much just about physiology and pharmacology that could be translated to have a great deal of impact in what humans experience is amazing to be able to do that. And then to work with people who are in the public policy area who are seeing what's happening on the ground, so what are people using? What are the economics like? How is the industry evolving in response to policy and also evolving in response to consumer need or consumer preference? So many of these puzzle pieces really come together in important ways to be able to establish studies, evidence, data to help support important information that should be disseminated related to safe ways to using cannabis, reducing harm, being able to give people, patients, consumers, clinicians, important information to be able to improve outcomes along the public health spectrum.
I love that you describe it that way because, yes, we've known cannabis for millennia and people have used cannabis for millennia. But I think in a way, all these sort of regulatory movements that might be a little bit ahead of what the science is has amassed like a significant amount of enthusiasm for folks like yourself, like many other colleagues around the world to come together. And as you mentioned, truly translate what's going on or rapidly translate what's going on in the lab, coming from the bench to the bedside, perhaps, hopefully like faster than in other areas. But it's because there's this impetus of trying to figure things out and provide the information to folks who are making decisions with respect to their cannabis use. Another angle that I find fascinating about your work, of course, it's that for a while, and you continue to do so, focusing on the sex differences between, the impact of cannabinoids between males and females. How did you decide that was something that you wanted to focus on, and what have been sort of like the main sort of contributions that you made to the space with respect to these differential effects of cannabinoids?
The sex-dependent story is really interesting, and I credit the preclinical researchers, for example, Rebecca Kraft and Jenny Wiley, and many, many others for really delving into this space, for helping to, I think, push this work along. But also, there's epidemiologists like James Anthony and many others who demonstrated that there were distinct differences between men and women with respect to how men and women were using cannabis, trajectory to developing cannabis use disorder or adverse events. I mean, that's already old literature. To fast forwarding to a time in the United States where, for the first time, if you look at prevalence of use of cannabis, for the first time in some demographics, women are actually using cannabis more than men, which is very unusual. I don't know of another drug where that is the case. So that's definitely happening there. And then the great deal of preclinical work that I think was really ahead of its time that demonstrated the distinct differences between male and female organisms in their response to specific cannabinoids, and how those responses that could have direct clinical implications, for example, sensitivity to THC, rapid acceleration of tolerance to THC in females versus males, and how those effects were mediated by reproductive hormones. And so, there have been other clinical researchers who kind of follow this line of work as well, colleagues in Kentucky and Johns Hopkins. And there are, notable differences, Although, when you look at people as a whole, there are so many, different variables to consider. Sex is just one of them, right? You're also, with respect to menstrual cycle phase, which is something that we're studying in the lab right now, how might that influence the effects of cannabis and specifically THC? But also, there's like, what age did they start using cannabis? How frequently are they using it? How old are they, right? We know that age now is a significant factor with respect to understanding the effects of cannabis in the brain and body. And so, there's a lot of different variables to consider. And I think the study of sex-dependent effects of cannabis kind of opened up the door for me to understanding other variables like this. For example, age. So we have a big grant where we're looking at the age-dependent effects of cannabis. And it's something that surprisingly hasn't really been systematically approached in a certain way where you're comparing the pharmacokinetics, how the body metabolizes some of these important cannabinoids, how just the pharmacokinetics might differ from somebody who is 55 and older versus, 18 to 25, the younger emerging adult group. Now, it's really important now because across the globe, we know that people who are 55 and older are starting to use cannabis at higher rates than ever before, or at least they're starting again, right? They might have used it when they were younger, but now they might be, they're starting to use it more for both medical and non-medical purposes. And for a very long time, we were very focused, or at least the literature was very much focused on this emerging adult period, the younger adults, and viewing them as potentially high risk for developing adverse effects associated with cannabis, and focus on understanding the pharmacokinetics and pharmacodynamics of cannabis and cannabinoids in that population. But the other groups, kind of got overlooked, because they weren't really a concern up until fairly recently. And so this is all to say that, the work that we've done trying to understand differences between men and women and their response to cannabis and cannabinoids has led to a great deal of interest looking at other individual or demographic characteristics and how that can also shape outcomes. So looking at sex, and then also understanding the effects of very regular use of cannabis. So people who are using cannabis every day, many times a day, versus people who are only using it occasionally, and how the outcomes, pharmacokinetic outcomes, how their potential therapeutic effects might differ, adverse effects might differ, in part because of tolerance development. How much of a difference is there between these groups? And there is quite a big difference. And we know now, in recent studies that we're wrapping up right now, that sex plays a role in that as well. Just like in the animal studies, where there does seem to be rapid tolerance to THC's effects among females, more rapid tolerance to those effects in females relative to males. In the preclinical models, we're also seeing that in humans as well, in a very profound way, where different effects are emerging between people, men who are using cannabis only once a week versus females who are using cannabis only once a week. It looks like their responses are quite different. Whereas if you're looking at men and women who are using very frequently every single day, those effects aren't so different. And so, hopefully very soon we'll be able to have those findings published. We're working on that right now. So that's a really important element that we're looking at.
That's amazing. And for sure, as you mentioned, the cannabis use has been really male-centric for the longest time. And now with the least regulatory movements and probably a little bit of, the better name that cannabis now has and the potential that it might have to treat or to manage symptoms. So a broader population is definitely willing to try and to engage with cannabis. But something else that is really interesting is that most of the effects of drugs that usually the focus seems to be around pregnancy and lactation, which is, really important, of course, but it's also important to understand what happens to a woman as they're using substances outside of those periods that are really, really key as well, and around perimenopause and menopause as well. So understanding how the effects are going to be different, whether the therapeutic effects are going to be, just as important as it might be for other populations, but also the adverse events as well. With aging, there might be changes in the receptors, in the cannabinoid receptors centrally that might, make us more prone to experiencing adverse effects from THC. So it's really important that we shed a light on those changes, because we do deserve a good quality information as well to make informed choices.
Absolutely. Yeah. And across the age span is absolutely critical.
That's fantastic. Well, thank you for giving us a little bit of a sneak peek into what you're finding with these new studies, and we look forward to seeing the results published. So if you were to sort of, obviously I mentioned, and you mentioned yourself, that you have already done so much work in so many different areas. If you were to sort of pick sort of one sort of big contribution that you think, I know you're going to be really humble, but if you think you could pick the one contribution that you've made to the field as a whole, they can say, yeah, this is something that I have really contributed. Which one would that be?
I think it's, I definitely don't ascribe things just to me. I think that there's been a elevation of the acknowledgement that it's really important when we talk about cannabis, and this is a very broad strokes general theme, when we talk about cannabis, that we're talking about a plant that has hundreds of chemicals in it, many of which we know, well, not many of which, but we do know that several of them are biologically and physiologically active. We know that the effects of those chemicals are going to vary based off of the individual, certain demographic features, like we're talking about age and sex, but also what their prior exposure is like. I mean, it's absolutely imperative that that's a part of the conversation. And then also the way that people are using it, right? So both their primary motivation, are they using it for medical purposes or non-medical purposes? But also the route of administration is really important. So, inhalation versus oral administration, the concentration or the dose of the different chemical constituents of the plant. And so it's, amplifying and recognizing and informing people that when we think about cannabis, it is really a disservice to think about it in a very simplistic way, because the outcomes, both acute and long-term, are going to vary significantly. I mean, in hugely meaningful ways. I mean, almost like you're talking about different drugs, different pharmacological classes, that are being lumped into this one term, cannabis. And so when we think about scientific studies and public policy and clinical implications, clinical guidance, it's absolutely critical that we keep those things in mind. So, I mean, I know that that's like a broader scope thing, but it is something that permeates, all of the work I do and the work that a lot of us do, right? It is teasing apart, these really critical differences. So one area of research that we're very much engaged in is understanding the effects of different cannabinoids that haven't necessarily been studied, but are commercially available. They've been looked at preclinically. For example, cannabigerol, CBG, cannabichromene, CBC, terpenes, cannabidiol, of course, and the effects on their own, as well as the effects when they're combined with THC, cannabinoid that we know a fair amount about. So that's something that we really strive to do, and something that we strive to do in our center, the UCLA Center for Cannabis and Cannabinoids, with respect to educating the public, patients, consumers, clinicians, is to try and emphasize that talking about cannabis as one thing is really a disservice, to the public and a disservice to science. And it's really important for people to understand the differences with respect to cannabinoids, dose, route of administration, and the person who's using it.
That is so important. It is definitely a foundational contribution. I mean, obviously, you and your colleagues and, so many researchers around the world are trying to get us to develop a more nuanced understanding what the impacts of different chemical composition of the plants, but also the routes of administration. So having that sort of like more sophisticated awareness of what's going on with the different methods and the different compounds it's really important. So if you don't mind sort of explaining very quickly, what have you found with the other cannabinoids and with the other terpenes in your lab? If you can share, of course, if this is ready to share with the public.
Yeah, and so these are studies that have recently been completed. And so, what we're finding is that some of these chemical constituents, for example, CBG, as well as some of the terpenes, could play a very meaningful role in augmenting the effects of THC, both with respect to some of the potential therapeutic effects, for example, the pain relieving effects of THC, as well as some of the adverse effects. Now, for the most part, I think that a lot of we think about, or it's been thought that some of these other constituents might help to reduce the adverse effects of THC, such as, we call this like a THC sparing effect. But what we're finding is that that's not always the case, that some of these constituents that might not have profound effects on their own, but in combination with THC might enhance analgesia. They might also enhance some of, the other effects of THC, for example, intoxication, impairment, so on and so forth. And so this is what we're finding so far. We're working on understanding if this is a pharmacokinetic type of interaction. For example, do these constituents augment the metabolism of THC? And maybe that's why we're seeing those effects. But this is what we're seeing. And, we do have a couple of other studies that are recently got funded, that we're starting, that will be underway to investigate some of the other cannabinoids. But, I think it's important, especially given the fact that people are purchasing these products thinking that these minor cannabinoids or these other chemical constituents might provide some substantial therapeutic benefit. Really understanding whether or not they contribute to the therapeutic benefit, at what doses they contribute it, at what mode of administration might they be helpful or actually harmful is really important for the discourse with respect to how these cannabinoids might be helpful down the road for therapeutic use.
It sounds like you will never be out of a job studying all these multiple combinations and the routes of administration, the different possible, as you mentioned, the combination of terpenes with the different cannabinoids and whether they spare the detrimental effects of THC or augment them, or it's going to be like an endless road for discovering what the effects of these compounds are going to be. Have you found anything that you were really surprised by in all these, experiments with respect to terpenes and cannabinoids that you didn't anticipate, that your team was like, wow, this is something that is really blowing our socks off. We did not anticipate it at all.
Well, some of it's not published yet, so I don't want to reference that. But I think, one paper, this is from a while ago, and it's actually from when I was in Meg Haney's lab, and she published this paper. It was one of the first papers that showed combining, cannabidiol, where we thought that cannabidiol would, based off of earlier studies, that cannabidiol would reduce the effects of the potential adverse effects of cannabis with THC in it. And, Meg pushed the doses up super high. I think it was up to like 1,000 milligrams of oral cannabidiol, and it really didn't have a meaningful effect on THCs, on the effects of cannabis with THC. So that was really surprising. One study that we're following up on was actually looking at opioid cannabinoid interactions. And so that was also, it's an older study, and it was really rooted on preclinical evidence suggesting that THC as a CB1 receptor agonist might have opioid sparing properties. And, what we found in the human study, where we were giving sub-threshold analgesic doses of a oral opioid in combination with smoked cannabis. And we were able to find similar results with the animal studies, where if you give a very low dose of an opioid that's not usually analgesic, and you have people smoke cannabis with THC in it, you can find a almost like a synergistic effect on the pain relieving properties of the opioid and I guess THC. So that was a really nice translation from the animal models. However, at the same time, we also noted that there were other effects of THC that were amplified. So, for example, they really liked the combination, more than you would expect. Now, we didn't necessarily see the same thing with a slightly higher dose of the opioid. So it seems like at the very low dose of an opioid, that's where you would see this type of synergism. Other people have looked at this effect with using oral THC in combination with higher doses of an oral opioid, and they did not find our synergy. And so this was an example, and I think it still is an example of how important the study design choices are in the outcomes, essentially. So, for those studies where we had smoked cannabis with an oral low dose of an opioid, we found this effect. We're hopefully going to continue doing some of that work, specifically with respect to terpenes as well. There's evidence suggesting that terpenes also might interact with the opioid system. And all of this really does come from the preclinical literature. So, total credit to people who are in the labs working with animal models to be able to understand, we have so many different terpenes, which ones might actually be viable targets to be able to focus our energy on. So we're hopefully going to do some of that work as well to understand how terpenes might also be able to augment opioid effects and potentially have opioid sparing properties as well.
That is fantastic because, as you know, in the industry, sort of more commercial side of things, there are so many things that are said that are alleged with respect to the different chemical compounds that are in the cannabis plant or that could be in any given extract. So people might get impressions of things that might not be rooted necessarily in science. So one of the questions that I wanted to ask, and this is something, from our guests have sort of entered the space through different ways, this conversation around the entourage effect. So from your perspective, do you think that it is, from the methods that we have currently to study the different effects of the cannabinoid constituents or the cannabis constituents, do you think it would be possible for us to be able to say there is a synergistic effect between the terpenes, let's say, or the cannabinoids, or we know for a fact that there's something happening, but there might be at a different level that does not involve the endocannabinoid or the cannabinoid receptors? There might be more pharmacokinetic interactions. How do you see the entourage effect playing based on what you've researched so far? And I know you want to be very careful with this.
Right. With respect to, this so-called entourage effect, where the way we're talking about it here is, how the chemicals in the plant might interact with each other. But you did mention the endocannabinoid system, which I think originally when we were thinking about when, the entourage effect was originally introduced, it was about how the different elements of the endocannabinoid system kind of work synergistically and work together. And since then it's evolved to kind of talking about the plant itself. I think that, thinking about how chemicals interact with each other, both either in a pharmacokinetic way or pharmacodynamically, I think it's fair that it could be possible that different chemicals act together. We see this with a lot of different, pharmacological agents where there is additivity or maybe even synergy with other chemical classes, right? So it wouldn't be unusual. The work, though, comes from having to actually investigate it and to understand at the concentrations that the plant actually makes, can these chemicals work together in a very meaningful way that potentially, and I think in this context, it's about improving patient outcomes and reducing harm, right? That's how we usually think about, the entourage effect. And so I think, there's definitely possibility there. It's a matter of really understanding the different concentrations, different routes of administration. What are the outcomes, right? So if we're thinking about looking at pain as potential therapeutic outcome, or hunger, or appetite improvement, reductions in nausea, we know that dose of these cannabinoids are going to be critical. We know that THC is very well known to increase appetite. But, if it goes up, if you take too high of a dose, it can actually produce nausea and reduce appetite, right? It can make people feel uncomfortable. So doses of these chemicals and understanding for other chemicals, for example, CBG, we're trying to understand CBG itself in animal models. It looks like it will improve appetite and feeding behavior in animals. It's very dose dependent. So again, if you go too high of a dose, you're going to not get that effect. But understanding, can CBG do this on its own without those classic THC-like effects, intoxication, impairment, so on and so forth? And can it do it by itself? And when you combine it with THC, can it further boost the appetite improvement of THC? And so this is something that we're looking at, but very carefully, looking at many different doses and combining the different doses. It takes a while to do these types of studies. For example, our CBG study, we're looking at 9 different dose combinations in a one person, right? And so we bring them into the lab 9 different times for 8 hours, and we administer the drug, the different dose combinations, and then we look at their behavior. For example, for this one, we're looking at pain and also appetite improvement. We're measuring all types of endpoints there. And so the work does take a while. And you mentioned, Paula, earlier on that, the industry is kind of outpacing the science. And this is why, it takes a while to do it. One of the issues is that, in order to be able to design these studies, we also need good access to study medications, right? So where are we going to get the THC from? Where are we going to get the CBG from? And that is one of the big challenges to our work. But, whatever we can do to be able to kind of chip away and understand this, potential entourage effect, or just in general, the effects of these different, cannabinoids in the cannabis plant, I think it will be helpful. Even if we're not answering a very specific question, it will help to broaden our basic understanding of the plant and the capabilities of these chemicals individually, and when they're given in combination as well.
That's so fantastic because, in a way, there's so much that has been said that is not necessarily as well supported. So again, I'm also a scientist at heart. I'm not a scientist, but I'm a scientist at heart. And I'm a clinician who really takes, pays great respect to the people who are doing the work and giving us the answers and all the information that we need to guide people into making the best possible decisions. So I do appreciate you people spending the time running the studies and doing the hard work, bringing people to the lab to try the 9 different combinations of cannabinoids, because I know that, from the research side of things, it's not easy to do, which is, as you mentioned, the industry might not necessarily be willing to be patient and wait for those results before they put out any claims. If you were to say sort of what was sort of like the main sort of public health challenge that you are seeing now in California with respect to, everything that has happened, great hopes for medical cannabis and then great hopes for adult use. And then now, things are settling a little bit, I would say. Are there any public health challenges that you're seeing now? Perhaps the rise in the use of extracts, of vaporized extracts, or any other forms of cannabis, extreme high doses, or even the influx from these intoxicating cannabinoids that are now sort of flooding all over the United States? Do you think that there's some challenges there that your group or other groups affiliated with you are going to be facing in the near future?
Well, I think that you kind of hit the nail on the head there, Paula, is that I think from a public health challenge and public health perspective, we're now dealing with the public perception that is in part shaped by the industry and also in part shaped by public policy, right? And the legalization of cannabis and how it's been rolled out, what is permissive, what is legal, what is illegal. And, we've seen a proliferation of products. One thing you noted was like the high potency products, whether that's, the quote unquote high potency cannabis, or what we have in California is, and in other states as well, are, let's say, pre-rolls. So they're, cannabis cigarettes, but they're infused with additional THC. So above what the plant can synthesize itself with THC, there's additional THC being added. We also have the concentrates like dabs, wax, shatter that have a lot of THC in those. And so you would think that with every inhalation, people are being exposed to a lot more THC than in the past and than what we've studied in the past. And then there's, the vape pens that are also increasing in popularity as well, which is an issue because we don't necessarily know, the health effects of the different constituents that might be in those cartridges, right? And the different elements of the vape pens, the different materials that are being used, that are being heated up to a certain temperature that people might be exposed to. This is an area that I'm totally not, an expert in at all, but just trying to understand the vape pen mechanics itself. And also now the convenience of the vape pen, right? So if people want to inhale cannabis or inhale THC, you no longer need to combust the product. You can be at your desk at work, you could be at a party, you could be at a professional event, right? And use a vape pen in a way that's much more discreet than, let's say, smoking, where in the past, if people needed to smoke, they would go outside or go to an area where they would be able to smoke. And so the ease and availability and accessibility and convenience of the vape pen, I think, will contribute to potentially increased use over time. And the question is, not just the elements of the vape cartridges and the effects of those, but also the overall outcomes that might be associated with that ease of use and maybe the increased use over time. So I think that that's going to be something that will be on the horizon, probably over the next 5-10 years, seeing, how vape pen use is going to evolve. Are people going to be using it with much greater frequency than other forms of cannabis? At the same time, I imagine that for some patients, the vape pen or a transportable vaporizer that isn't super heavy and bulky, for patients who are using cannabis several times a day for, relief of symptoms, they might really welcome this. So, it's a very complex situation. But this is what happens when we have a public policy landscape that is kind of open for creative ways that, the industry can come in and develop different products that can appeal to different groups of people. So over time, we'll learn a lot more about what the potential impacts are of these types of products.
And I think you raise a really good question with respect to the uncertainty that surrounds many of these new devices and these new routes of administration. Because one thing is, as you noted, what we know so far is mainly from the smoked cannabis, from the 12%, 15% concentration of THC that we've studied in the past. And there's reasonable information around that. But then when you start sort of deviating from that and just becoming more creative, there's very little information that can be given to a patient or to somebody who just wants to pick up a device like this so they can weigh the pros and the cons and they can make an informed choice. So it's really complex for sure. Because on the one hand, you have the commercial impetus to allow all these sort of variability of products and diversity of products in the market. But on the other hand, you want to instill a sense that people should be making informed choices with respect to what they're doing with their cannabis. And that information is not, unfortunately, there yet for many of the things that are coming into the market. So yeah, we're going to stay tuned for your work and for the work that some of your colleagues are doing in this space so that they can help us understand, if the ease of convenience is going to change behavior too. It might end up being that is the situation. So looking to the future, do you think that there are research questions that should be asked, in the next 5 to 10 years to help shape the cannabinoid field a little bit? You've already highlighted some of those areas, but from your sort of personal interest and in your exploration of the cannabinoid impact in pain and the use of terpenes potentially for the treatment of pain, is there anything, like any research question that you think the whole field should be answering in the next little while?
I think just in general, it's amazing how much more work there's been over the last several years, placebo-controlled studies addressing the potential therapeutic effects of cannabis and cannabinoids. I think, keeping an eye on the potential adverse effects as well is really critical. And on the flip side, a lot of studies that are looking at the adverse effects of cannabis and cannabinoids, talking about cannabis use disorder and things like that, differentiating, I think, how we think about the adverse effects in cannabis use disorder in people who are using therapeutically, and how are we going to evolve the definition or the diagnosis of cannabis use disorder in that population who are using therapeutically? And I know there's a lot of definitions that have to be operationally defined, but this will be an important distinction down the road, just like we were talking about distinctions of defining cannabis in a conversation about cannabis, defining, what chemical are we talking about with dose, what route of administration. But I think that will be really important with respect to public health, concerns and pressing public health needs, I think it is really important, to address the effects of these different products, the high strength cannabis, the different ways that people are using it. Again, both in groups of people who are using it for medical and non-medical use. This is an issue that, at least in the United States, is not going to go away. And probably in Canada and some European countries. I don't know about South America, but these products, now that they're out, it's going to be very difficult to figure out how to regulate them and how to reduce use because people are using them and they're available. So I think that that's going to be an important area of consideration. We never dreamed, or I never thought that I would hear something like cannabinoid hyperemesis syndrome in, people who are using cannabis, developing really painful vomiting, a very painful vomiting disorder where they're, coming into emergency rooms. This is an adverse event that I don't think any of us would have guessed we would have seen 10 years ago, 15 years ago. And yet, now we're hearing about it with much more frequency. And so the question is, keeping an eye on, if there are other adverse events that, again, we wouldn't even have thought about or that we don't know about, and seeing what's going to evolve over the future. And similarly, for therapeutic effects as well, we might find that, the different products that these companies are producing, there might be certain patient populations whose needs are really being met with these types of products. And being met in a safe way. And so keeping an ear out for those. So, keeping an eye on both ends of the scientific spectrum, right? So always taking a peek at what's happening in the animal literature, as well as on the epidemiological area and survey research, keeping an ear out for important, interesting trends, both with respect to the potential therapeutic effects of the plant and its chemical constituents, as well as the potential negative effects that we might not be aware of at this point in time.
So having a more comprehensive look as to what's happening with the different impacts, negative or positive, that cannabinoids may have. That sounds like really sensible, lines of research into the future. I wish, I don't know, what the landscape's changing in the United States with respect to this potential, new descheduling or rescheduling of cannabis, but in South America, unfortunately, the investment into these kinds of sort of well thought out and systematic approaches to research to understand what's happening on the population level might not be that frequent. But, we can only hope that the governments are going to do the right thing as they start sort of loosening a little bit more the restrictions that have been existing around cannabis for such a long time. And now to finalize, Dr. Cooper, it's been wonderful chatting with you. I could stay chatting with you for hours and hours. I have so many more questions. Every word you mention, I wish I could ask her this, but I can't because we are limited time. But I just want to ask you, so in Latin America, the field is rather new. There are some, countries that are opening up cannabis for medical purposes. And of course, there are going to be young researchers that are going to be interested in just sort of entering the field. What advice would you have for these young folks that really want to start making inroads into the cannabis space?
My advice is to talk to as many people as you possibly can. There are so many inspiring and influential people in this space along the career trajectory, from people who just started to, people who are trying to retire, but we won't let them retire. And, it's a really exciting area, and, it could be frustrating at times. But in the end, when you have a holistic perspective on what you're doing and what you can do and what you can contribute, it is really extremely meaningful and satisfying. So I guess that would be my piece of advice, is just, talk to people, listen to podcasts such as these, and I can assure you that you'll be inspired.
Thank you for the shout out. That's amazing. I cannot thank you enough for your time. This has been such a wonderful conversation, long overdue. I've been wanting to talk to you for such a long time, and it's a treat to have this opportunity. And again, well, thank you for the support that you've lent our organization. We are a small but mighty group, and we're still keeping strong and trying to gather as many folks in the region who want to learn, from a really ethical and scientific and really grounded way about what's going on with cannabis on, as you mentioned, in all, spectrums where cannabis can operate and get cannabinoids and keeping tabs with, those folks that are writing the stories, that are writing the science, such as yourself and all the other guests we've had in our podcast so far. So we're really grateful. And we look forward to chatting with you again in the near future. Thank you so much, Dr. Cooper.
Thank you. Thank you so much for having me. It was really a pleasure.
Thank you so much.